Hi, this is Dr. David Green, CEO of the U.S. Pain Network. I want to tell you briefly about a new study that just came out looking at over 5,000 patients at the effectiveness of a spinal cord stimulator. Now, a spinal cord stimulator is a great last resort option for someone suffering from chronic pain that doesn't have an option for surgery. Okay, so they've been around for decades. They've gotten so much better with the technology. The newest ones are called high-frequency spinal cord stimulators, and they're just what they say, high frequency. And what happens is they can replace a patient's pain and basically just take it away. The older ones that are still being used as well take a patient's pain away and they replace it with a tingling sensation. So you still have those, and you have the high-frequency ones, which work well for certain conditions. Anyway, this study looked at traditional spinal cord stimulators. The study was funded by a company called Abbott, which actually makes several varieties of spinal cord stimulators. So while there's a potential for some bias there because they funded it, it's over 5,000 patients. So they had a really good statistical significance in the study. They found a few compelling things. The first is that over 93% of patients who had the spinal cord stimulator in for a year were able to reduce the need for opioid medication. Okay, so that's compared to people who had it taken out for whatever reason before the year was up. They typically had an increased need for opioid medications. So there is a dramatic effect with having the spinal cord stimulator with having a decreased need. Now here's what's so compelling about that is that usually when you have chronic pain and you're taking opioids, the physician will need to slowly give you more and more medication to get the same pain relief effect. That's called tolerance. And that can also lead to addiction. So opioids are a good thing, but they can also have a lot of complications. And I'm not just talking about constipation. I'm talking about they can decrease your respiration. They can lead to an overdose if there's a mistake involved. And the addiction issue is so much of an epidemic now in this country that spinal cord stimulators have been, revolutionary, a godsend. The newest ones have these paddles that go up against the spinal cord, and they emit electrical impulses, and they have like over 200 programming options. They've been revolutionary with how many different ways they can get relief. And so what that means is it used to be that a lot of them failed within like 2 years. Now, between all the programming options and the new ones called the high-frequency spinal cord stimulator, that often doesn't happen, and people can use them long term. Thanks for watching our video today. Visit us at uspainnetwork.com. We have a physician locator where you can look to find treatment around the country. Thank you for watching.